Welcome to an overview of Ramp Health's proprietary next-gen digital platform. As expected, the Ramp Health platform is high trust, SOC 2 Type 2, and HIPAA compliant. So what are we trying to solve for? Many platforms available in the employee benefits space today are built on old technology, an outdated digital experience, and a lack of personalization, resulting in low engagement and underwhelming outcomes. Ramp Health, rooted in 22 years of on-site coaching interactions, has executed over 7 million high-touch, in-person wellness and chronic condition coaching sessions and positively impacted thousands of companies' at-risk populations. We combined our high-touch approach with a high-tech platform to create a cutting-edge digital coaching and engagement experience. Our tech stack, developed in 2023, incorporates the latest technology and digital engagement resources. This enables us to dynamically connect with individuals by fully understanding their risk factors and readiness for change. By employing psychographic segmentation, we deliver content tailored to each person's unique personality type, thereby inspiring them to adopt life-changing new habits. There's no one better to take you through the Ramp Health platform than the individual who helped build it. I'd like to introduce you to Mike Larkin.
Hi, I'm Mike Larkin, Director of Platform Operations here at Ramp Health, and I'm super excited to tell you today about our platform. 2 notes before we jump in. We're available right out of the box in several different languages, including Spanish and simplified Chinese, and we're 100% fully featured via any modern mobile browser, as well as our iOS and Android apps. That means that we can always meet our participants where they are, instead of expecting them to meet us. Well, let's get right into it. Ramp Health's platform allows participants to engage in a personalized health experience catered to their unique needs. Our 3-column design focuses on easy program navigation here on the left, our activity cards feed here in the center where a majority of the participant interaction will take place, and a data dashboard here on the right. The experience is highly configurable for our clients, as well as their plan designs, incentive structures, wellness programs, and goals. As the participant interacts with the platform, thousands of algorithms create conclusions about the participant to best serve them relevant content. These data sources include our assessments, trackers, provider interactions, as well as external data sources such as claims data. We start by consuming self-reported data via our Living HRA, which a participant will complete at the beginning of their journey with us. Unlike a traditional HRA, we'll re-ask certain questions seasonally, as we know an individual's health changes from winter to summer. We also try to start every interaction with our participants by asking various lifestyle questions, our life check-ins, to better understand what content they need to see today. And when you think about it, we start most of our social interactions with "How are you doing today?" And we need to know how they're doing because their health will change throughout the year. We also have companion assessments that focus on specific areas like burnout, resilience, stress, readiness to change, so that we can get a 360 view of our participants' health. We consume biometric screening information as we know the blood doesn't lie, but we also know that your average at-risk population knows their numbers and traditionally don't participate in screening events. That's why Ramp Health integrates with participants' wearables and tracking apps, in addition to home medical devices like blood pressure cuffs and glucometers. And to round out our participant inputs, we can also consume claims information to trigger content around a recent diagnosis or medical event, as well as your custom data to best target participants. Many of these insights are surfaced back to the participant via the health profile. But a static page about the platform's conclusions isn't enough. So the health profile surfaces additional context to the individual, such as their history with that metric, why it's important, as well as activities they can engage in right away to start mitigating an identified health risk. They can also download a copy of the health profile to work with our providers or take it into their trusted care provider. But let's take a look at 2 different versions of the platform so we can see how it personalizes to the individual. These 2 examples are under the same plan design. On the left is a profile you've already seen, Let's assume that we don't know a lot about them yet, so when we tell them to talk to a provider and schedule an appointment, the call to action is more generic. But as we learn more about them, such as the profile on the right, we start to vary that same content to focus on specific attributes we think will be resonant to them. Instead of a generic call to action around a coach, we've discovered that this person is pre-diabetic, so we want them to talk to one of our DSMES specialists instead of just a coach. This is just one example of many activities within the platform that can personalize themselves to the participant to create resonant, engaging content that speaks to the individual as opposed to a one-size-fits-all model. This can also trigger content around new program eligibility, a specific incentive, or maybe custom messaging around benefits that are available to them. Let's also take a look at a totally different configuration and plan design. We strive to give participants the option of earning in a variety of ways within our wellness programs. For example, they could earn from a generalized incentive by completing any activities, or a more narrow incentive that we designed out of the box for wellness programs and premium discounts. This module allows you to create buckets of incentives where participants need to complete a variety of activities in some combination to earn a specific incentive, and groups of activities can be required to be eligible for any incentive. We've also baked in reasonable alternatives for ease of use. In this example, we can see that the HRA and screening group is required, so even though they've completed these biometric outcomes, they don't have credit for the incentive yet. Importantly, many of our biometric and connected tracker activities use automated completion to streamline the participant experience. All of this is supported by turnkey reporting on the back end for both incentives as well as our parallel module and other modules that we've developed for incentive design. We strive to make administration of programs as easy as possible for you and your stakeholders. Let's go to another configuration. We like to help our clients engage in a culture of health by putting a variety of potential activities in front of our participants. For example, our social feed prompts them to share very specific pieces of content, such as things that help them de-stress. Others within the program can interact with that post and learn as well as foster a stronger culture around health. Our newly designed Challenges module allows participants to set their own personal goals as well as work towards a team goal, all within a socially supportive environment. RAMP's platform offers a robust set of features and rich content, such as our courses, which cover more in-depth health topics, our missions, which help participants set small goals and allow the platform to reinforce behavior, or contests, which focus more on individual efforts for competitions around things like steps or overall program engagement, all personalized to the participant. We make all of these insights available to our clients via a robust administrative portal. All of this was built in-house to make it as easy as possible to deliver the solutions that you need for your clients. No other wellness platform has this omni-channel, real-time input and ongoing interaction with their participants to update relevant risk mitigation content in real time and empower you to help your employees.
Next, let's hear from Katherine Rowe, Director of Platform Intelligence, to cover the tools of the Ramp Health platform.
Hi, my name is Kat Rowe. I'm the Director of Platform Intelligence here at Ramp Health, and I'm excited to give you a little overview of how our content tools can empower you to create a wellness program that truly reflects your company's values and objectives. Before we get into that, let's take a quick look at what our standard experience looks like from the participant side. The Ramp Health platform allows participants to engage in an experience unique to them. As participants engage with the platform, the content experience will begin to transform to show and prioritize cards that are going to be the most impactful and best align with their readiness, interests, and program offerings. We have a number of customizable features we can leverage to surface information to your participants, But today we're going to focus specifically on how our admin tools can allow you to create targeted ongoing engagement cards, events for the calendar, and even some highlighted benefits. Let's dive into the ease of card creation first. With our platform's powerful content creation capabilities, you can layer your unique content on top of our standard platform experience to elevate your wellness initiatives. Ramp Health's content management tool is designed to make content creation simple and effective for our internal teams, strategic partners such as brokers, as well as our valued clients. Custom cards allow you to highlight new offerings, share information on organization initiatives, or effortlessly provide reminders about an upcoming initiative. Cards can even be enabled to prompt participants to share photos on your organization's social feed, fostering a dynamic and interactive wellness culture that strengthens your company community. Some of our clients have taken it a step further by targeting programs or information to individuals who meet specific criteria without ever needing to reveal the participant's personal health information. This might be through information on the front of the card or through expanded content screens. Additional mechanisms such as adding a screen for infographics, audio, or video make it easy to expand the experience to include unique elements, such as safety videos targeted to specific departments. Let's take a look at how this card we just created went from being simply an idea to making an impact on participants in a matter of minutes. Now for creating events. Many of our clients utilize our platform to showcase organization events such as lunch and learns, wellness workshops, and health fairs, building excitement and encouraging participation. Our platform makes promotion and event management a breeze. Using our admin tool, you can create and manage events tailored specifically to your group's offerings. As with custom cards, events have a wide range of customization options, including options like enabling an announcement card, email distribution, RSVP, or adding specific time slots. Even if you don't need an RSVP, the events calendar can be a valuable tool for informing the population of upcoming happenings or deadlines, such as open enrollment. The last content mechanism we'll highlight today is our benefits section. For clients who prefer to show available benefits in a static dashboard, our benefits feature is the ideal solution. This feature brings persistent visibility to individuals, boosting engagement by surfacing them in an easy-to-locate place and supplementing the dynamic experience of the card interface. The benefits feature allows you to surface variations on benefits available to specific populations, ensuring that resources only available to a subset of the population are only seen by those individuals. So creation of all of this is great, but how do you know the impact it's actually making? Well, reporting is also done through our admin tool, allowing the entire process from promotion through reporting to be easily managed in one platform from start to finish. These integrated analytics provide the insights you need to ensure your efforts are boosting engagement and utilization, as well as providing valuable data on what benefits would be most impactful to your population. Our platform is built for customization, letting participants enjoy a personalized and relevant experience while fostering company culture through simple access to organization news, benefits, and events. Contact Ramp Health today to experience the power of a truly customizable and targeted content delivery platform.
As you can see, Ramp Health is the only single source provider leveraging over 2 decades of in-depth coaching expertise to deliver a proprietary, real-time employee platform for organizations. This platform, distinguished by its coaching-centric approach, is designed to make a significant impact on your at-risk employees through enhanced employee engagement, effective communication, and support. We're eager to meet with you in person and give you a live demo. We'll showcase how we can configure the platform to fit the unique contours of your company culture.